This program is rated PG. It contains themes and scenes which may not be suitable for very young audiences. Parental guidance is advised.
Be advised that the views and opinions of the hosts and guests do not reflect those of the station.
A dilemma is a situation in which one needs to choose.
Paano ako gagaling?
It's an ethical issue.
As
Supposed
opposed
to
to
help us.
Medical Dilemma.
Hi, I'm Sonny del Rosario, and you're watching Medical Dilemma. Diabetes, contrary to what one might think, is not a measure of how sweet one is. It is a condition that arises from the lack of insulin production. And if unchecked, could lead to certain complications that are tremendously difficult to reverse. With the help of our guest, we will take a look at the conditions and the facts that surround diabetes as a condition, and we will try to separate myth from truth. For our first segment, we have Dr. May O. Sison, an endocrinologist from the Makati Medical Center, head of the Diabetes Care Center, diplomate and fellow of the Philippine College of Physicians and Philippine College of Endocrinology, Diabetes and Metabolism. Welcome to the show, Dr. Sison.
Thank you. Thank you for having me here.
Okay. Now, for the first segment, I'd like to talk about the basic concepts about diabetes. First of all, let's talk about your specialty, endocrinology. What exactly encompasses endocrinology?
Endocrinology is actually the study of endocrine glands and the hormones that it secretes. So hormones are substances that are produced by the body and which are carried into the bloodstream, and they go into tissues where they exert some effect, stimulate some cells to exert some effect.
And which parts of the body secrete these hormones that you just mentioned?
There are several organs that secrete hormones. We have, for example, in diabetes, we have the pancreas. The beta cell of the pancreas. We have the thyroid gland. We have the pituitary gland and the gonads. And also we have the adipose cells.
Okay. Now, in terms of diabetes, it's the pancreas that is connected to the condition.
Yes.
Okay. So if I'm right, when insulin production of the pancreas decreases, that is what leads to diabetes. Is that correct?
Yes. Either there is the reduction in insulin production, or the tissues are not responding to the insulin that is produced by the body, a condition which we call insulin resistance.
I see. So it's either the lack of insulin
or the lack
resistance
of
to
insulin action. Yes.
Okay. So I suppose there are different types of diabetes.
Yes, we have several types of diabetes. We have the type 1. Type 1 diabetes is a condition wherein there is absolute insulin deficiency because of the destruction the beta cells of the pancreas. So in these cases, they are insulin dependent. So without insulin, they will not live. The type 2 is the one that is wherein the pancreas is still producing insulin, but there is resistance, insulin resistance to the action of insulin.
Okay. Now, if we separate these two types of diabetes according to their causes, what are these causes for type 1 and for type 2?
Type 1 is usually, they say that it's due to some autoimmune. It's autoimmune. There's a destruction of the beta cells of the pancreas. And sometimes they say it's due to the virus that a child develops, even from infancy or later on in their lives. While the type 2 diabetes is actually usually genetic. You inherit the predisposition to develop the disease. And of course, if this is a predisposition, there should be a trigger factor for you to develop diabetes. And the number one trigger is obesity. and sedentary lifestyle.
Sedentary lifestyle.
Also stress.
And stress.
Yes.
Okay. So, if we suffer from these causes, are there symptoms that we can watch out for?
Well, there are some things that are common in patients who are predisposed to develop diabetes. For example, if a person is overweight or obese, if the patient does not exercise, or the patient has a family history of diabetes, first consanguinity, or if woman has history of what they call, or the other third type of diabetes, gestational diabetes.
Gestational diabetes.
Yeah. Or those who have hypertension, those who have high cholesterol, and then these people should undergo tests for diabetes.
And what are the tests that are carried out to confirm the condition of diabetes?
Well, we have the fasting blood sugar, which is the most common in the ECS. So you do the blood test after 8 hours fasting.
Okay.
And then there's a certain level wherein you can say that the patient might be diabetes. A level of 126 milligrams and above is, if done 2 times and yielding the result over 126 or equal to 126, then the patient is already diabetic. Then
So you repeat the same test?
You can repeat the same test. But the other ways of diagnosing diabetes is by what we call HbA1c. It's a hemoglobin A1c. It's our sugar is attached to the hemoglobin.
Okay.
And usually we measure it every 3 months. And if your HbA1c is 6.5% or above, then most probably you're diabetic. So if it's repeated and it's still 6.5% and above, then probably you're diabetic. Then the third test is what we call the oral glucose tolerance test, wherein you challenge the patient. You give 75 grams of glucose after 8 hours fasting, and then you get the blood sugar 2 hours after. And if the level is 200 milligrams or above, then chances are you are diabetic. You can diagnose a patient by any two of them. So if they are both elevated, for example, if the FGG and the HbA1c are both elevated, then you are already confirmed diabetic. But if there's a difference, for example, your FGG is normal, but the HbA1c elevated, then you repeat the one that is elevated.
That is elevated.
Then if the results come out again elevated, then you are already confirmed diabetic.
I see. Okay, Dr. Sison, we'll talk more about these tests after a few words from our sponsors. Okay, we'll be right back. Don't leave this channel.
Out of my mouth, especially in such a place where anything can spread like wildfire. When you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?